Hello, I'm Donna Walsh, Health Officer for the Florida Department of Health in Seminole County and your Healthy Seminole host. Public health protects, promotes, and improves the health of people in the communities where they live, work, learn, and play, from vaccinating children and adults to preventing the spread of disease, educating people about the risk of tobacco, as well as providing testing and treatment for HIV and STDs, and regulating public health facilities. Although public health has transitioned over the years to meet the changing needs of the communities it serves, the foundation remains the same, to ensure conditions where everyone can be healthy. During the show, you will learn more about public health and the resources available in the community. What first comes to mind when talking about public health is services offered at the health department, such as immunizations, women's health, and dental, although it is much more. Joining us is Venice White, Manager for the Florida Department of Health and Seminole County Office of Health Promotion and Education, to enlighten us on the topic. Welcome, Venice.
Good morning, Donna. Thanks for inviting me.
Our pleasure. Venice, as a career public health professional, what does public health mean to you?
I'm often known as saying, I am public health and we are public health. Public health is addressing health outcomes at the population community level. So that's protecting communities, whether it's vaccinating children, chlorinating water, or encouraging everyone to get their steps in and exercising and eating healthier. So public health is promoting health outcomes for all and living our best life.
So Venice, throughout the year, there are a number of health observances recognized. Is there a particular health observance specifically for public health?
Yes, Donna, there is National Public Health Week. And National Public Health Week is spearheaded by the American Public Health Association. It's observed every first week in April annually. It's a time to celebrate our successes in the field of public health and also to celebrate us, those professionals that make public health happen in the community.
So what type of activities usually occur during the dedicated Public Health Week?
During Public Health Week, what we do locally here in Seminole County, we host in collaboration with community partners such as No Limit Health and Education, our annual Live, Work, Move Seminole 5K. And this 5K is an opportunity for that person who didn't think that they could finish 3.1 miles. So we're encouraging physical activity, making healthier a fun choice for those to get out and walk or run or bike or swim, just get moving. So we do have that annual event with a free kids dash because we do want the entire family to be healthy. And then we also do things with our employee wellness committee to celebrate our staff and our employees and partners.
That's wonderful. As a participant in the 5Ks, I can tell you it is a wonderful event. It's so fun. And you know, whether you can run the whole distance or walk the distance, walk-run combination, it's for everyone. So, and we appreciate you hosting those every year. So Venice, what does the health department do in the community?
Here in Seminole County, the health department is a strong pillar of convening community partners, both traditional like law enforcement, school board, faith-based communities, but also non-traditional partners such as the city planners, engineers. So the role of our health department is to provide data to help with epidemiology, outbreaks, but also to offer health promotion and education in the community, not just birth certificates and vaccinations, but we do a lot of health education and promotion to make health fun in the community. Absolutely.
Can you tell us a little bit about some of the programs that are offered to the community?
Non-traditionally, what we do in Seminole County as a health department, we have a farmers market to address health disparities and a food desert in Goldsboro. So we have a farmers market. We also offer free yoga classes in the community for youth and adults, which is something you typically do not see at a health department. We're known for coming outside of our walls and bringing the community to different events that we host. Also, we have the annual 5K, which I mentioned earlier.
Denise, how does the health department ensure that everyone has an equal opportunity to be healthy? What is health equity and how is it addressed?
Health equity is believing and putting measures in place that everyone has a fair opportunity and fair access to strategies, services, the tools that they need for the healthiest outcomes for themselves. We do have a health equity advisory board to address all disparities that we are seeing in Seminole County.
Can you tell us about a new initiative, the Congregational Wellness, and how that came about?
Yes.
And what does that mean for the community that we serve?
Amen. That's right. A lot of times at the health department, we would host events at our facility, which is a beautiful facility, but we noticed that the turnout from the community was not always as expected. So I decided to partner with the faith-based community so that we could start working with them, addressing their needs and supporting them with what they would like to see, and also hosting health fairs and screenings at their location.
Sure.
With Closing the Gap funding from our state office, we were able to apply for a grant to fund the Seminole Congregational Wellness Program. And basically, it's partnering with faith-based communities to provide a survey of their congregation members. This program actually designates health ambassadors from the churches, and they plan with us for them, for their congregation. So it's establishing health ministries, or some churches are ahead of the game and they have health ministries.
Sure.
So we do provide resources and demonstrations to those churches to enhance existing health ministries.
What a wonderful program. And we're so excited about the progress in our community. Venice, in closing, what important public health message would you like to share?
Going back to my mantra, I am public health, we are public health, taking personal responsibility not just for ourselves, but taking a personal responsibility to making sure that we make health and healthier choices an easy choice for everyone in the community. So that's through partnerships, even encouraging you, Donna, you can do this 5K, and we'll do it strong. Just encouraging each other and making a personal commitment, because together we can make this a healthier nation.
Thank you so much, Venice, for joining us. And thank you for sharing about public health today.
Thank you.
The Florida Department of Health and Seminole County's dental care program is committed to helping patients care for their smiles. Reporting from the dental care program is Myrna Chamorro.
Joining me is Dano Mistry. She's the manager for the dental care program. Thank you for being with us, Dano, and tell us about what dental services are offered here at the health department.
Okay, thank you, Myrna, for having me here today. The dental services we provide are exams, x-rays, fluoride treatments, sealants, fillings, and simple extractions.
And who can benefit from these services?
Anyone actually from the age 3 and up. So we see Medicaid and also self-pay. So if anybody is interested, they can come and schedule an appointment.
So children and adults?
Children and adults. Children is mainly for full service, adults are emergencies mainly, and simple extractions.
So if for some reason you cannot offer certain services, what options are for patients?
We do provide referrals. So if, say, somebody comes in and needs an oral surgeon and they have Medicaid, we would refer them out through the insurance to an oral surgeon.
So you have a wonderful program with the school system, the dental sealant program. Tell us about that.
Our sealant program is run by our hygienist. She has a portable unit that she takes to the school. She goes to 13 Title I elementary schools in Seminole County and provides preventive services there, including sealants. Sealants are very beneficial. It prevents cavities, and in the long run, it saves cost instead of doing fillings. Yeah.
So us adults and the children, how can we keep a healthy smile? What can we do?
Definitely brushing twice a day, flossing at least once a day, visiting your dentist every 6 months, and also cutting back on your snacks. Frequent snacking can cause problems as well, and also watch your sodas and juices and things like that.
So I hope everyone can practice those tips. And where can they call for more information or to make an appointment?
They can definitely call our dental department, and our phone number is 407-665-3346.
Thank you so much, Dana, for that great information.
Thank you.
The Florida Department of Health in Seminole County recently celebrated the Community Food Pantry and Public Health Garden ribbon cutting and groundbreaking event. The garden and food pantry are possible thanks to the many community partners who support public health. These initiatives help reduce food insecurities in the community. Here are some highlights.
Have you guys ever grown bell peppers?
Oh, yeah!
Yeah?
We want to welcome you to our celebration today. It's celebrating our public health garden and food pantry groundbreaking and ribbon cutting celebration.
Okay.
We do have support from Second Harvest Food Bank supplying our food pantry here, but we wanted folks to also have healthy options. So we thought, well, why don't we marry the Farm Daddy boxes, with our atrium here. So we have partners here as well to help us with our garden.
This is what Farm Daddy's all about, is teaching people to be self-sufficient, growing organic, healthy food right at their back doors and at any location. And now here at the health department, right in their foyer, we're going to grow fresh organic vegetables to be distributed. So our motto is always teach someone how to fish, not just to give them a fish.
Can you get your hand in there to dig that pepper out? You can do it.
Food pantries are great and non-perishable items are great, but there is nothing like going out to your own garden and picking a green bean and eating it. There is nothing like watching a child pick a cherry tomato from a plant and popping it in their mouth when it's still warm from the sun. Those are the kinds of experiences that we want our children and our community here in Seminole County to have.
We also know that there's a number of initiatives in the community, like the Goldsboro Elementary School, that have their garden, and a beautiful garden. And so we thought, how fun would it be for the kids to come over and teach us how to start a garden?
So you gotta squeeze it, you gotta break up the soil, and then we're gonna put our hand in, dig down to the bottom, and look, there's our pepper. All right?
We saw health disparities in this community as well, with heart disease and diabetes and obesity, and so this was a means for them to have healthy options. The Florida Department of Health in Seminole County works to prevent disease of environmental origin. Environmental health activities focus on prevention, preparedness, and education, and are implemented through routine monitoring, education, surveillance, and sampling of facilities and conditions which may contribute to the occurrence or transmission of disease. To tell us more is Kurt Jennings, environmental specialist too. Welcome, Kurt.
Thank you for having me, Donna.
Absolutely, it's our pleasure. Kurt, tell us what environmental health does each day.
We do a lot of different things. We go out and we do inspections at different facilities. We take surveys. We're just driving all over the county, making sure that we're trying to keep people safe.
So how does environmental health keep our public safe?
We use the Florida statutes, the rules, and we apply those to the facilities that we do inspect and make sure that they're within the guidelines that need to be.
Okay, so those are the regulatory functions of environmental health then, and my understanding is through Florida statute and Florida Administrative Code, we have those specific rules we have to follow to keep the public safe.
Correct.
And that's, as you mentioned, either through water or sewage or food. Okay, great. Tell me a little bit more about the water program. So in other words, how do we keep our recreational water and drinking water safe, Kurt, specifically?
We have approximately 600 public swimming pools here in Seminole County. I personally inspect over 300 of them. Yeah, we check for chlorine or bromine disinfectant. We check for the pH level. We check for the safety equipment, shepherd's hook, safety lines, those sort of things. We also check and make sure that the equipment is running correctly, that they haven't swapped anything out and are no longer using what they were using previously. As far as drinking water goes, we will sample any place that was around a dry cleaner or a gas station, just to make sure that there are no unsafe chemicals that are leaching into the drinking water.
Sure, sure. Those are all very important functions of environmental health and public health, for sure. Also important is our food establishments. You mentioned keeping our food safe, and I understand that the regulatory function of that has shifted a little bit over the years from public health to other agencies. So tell me public health's role as well as other agencies' roles in food safety.
Okay. Department of Health, we inspect more or less institutional type facilities. So we do schools, assisted living facilities, adult daycares, bars that don't serve food, as well as the jail, which is one of my favorites. Things that we do not inspect are restaurants. The Department of Business and Professional Regulations, they handle restaurants. And grocery stores, convenience stores, they're handled by the Department of Agriculture and Consumer Services. The only time that we will go out on a restaurant inspection is if there's a foodborne illness investigation and they need us to kind of lend a hand.
Sure, absolutely. So Kurt, what type of permits does the Public Health Environmental Health Program issue?
We issue permits in all the programs that we work in. Last year alone, I believe we issued over 4,000 permits, including 800 septic tank permits for new construction or repairs. Like I said, the 600 swimming pools that we have, over 1,000 biomedical waste permits per year, so we do a lot.
Kurt, tell me what is the value of a permit? I understand it's per regulation, but what does that mean to a contractor, to a business?
It allows them to keep performing the business that they have for us. For a septic tank, it tells them how big the tank needs to be, how big the drain field needs to be, the elevation that the drain field needs to be installed at. And for like a swimming pool or a food establishment, it gives them the authority to keep having the public use that facility.
Kurt, what message would you like to leave for our audience regarding environmental health?
Most people think, when they think of environmental health, they think of the big bad health inspector that comes out and is going to shut places down. We're not actually there to do that. We're here more for education rather than regulation, letting people understand why there is a violation or what they can do to correct it, rather than say, you're being naughty, we're going to shut you down.
Right. Kurt, thank you so much for joining us today and for sharing about the environmental health program.
My pleasure. And by the way, I've got about 300 pools to do myself, so I need to get out of here and get started on those. We'll see you later.
Everyone deserves the opportunity to live a long, healthy life, free from preventable disease and injury. Across the country, public health workers ensure the basic foundations necessary for good health. Here are a few contributions of public health. Vaccinations. The use of vaccines helped in the eradication of smallpox, elimination of polio in the Americas, and control of measles and other infectious diseases in the U.S. and other parts of the world. Vaccines continue to keep our community safe today. Control of infectious diseases. Clean water and improved sanitation has dramatically reduced infections such as typhoid and cholera, major causes of death early in the 20th century. Safe and healthier foods. Since 1900, decreases in microbial contamination and increases in nutritional content have resulted in safer and healthier foods. Healthier mothers and babies. Better nutrition, the availability of antibiotics, greater access to healthcare, and technological advances in maternal and neonatal medicine have resulted in healthier mothers and babies. Family planning has provided health benefits such as longer interval between the birth of children, increased opportunities for preconceptional counseling and screening, fewer infant, child, and maternal deaths, and the use of barrier contraceptives to prevent pregnancy and the transmission of HIV and other STDs. Fluoridation of drinking water has provided benefits to both children and adults by effectively preventing or reducing tooth decay. Recognition of tobacco use as a health hazard and anti-smoking campaigns have resulted in lower initiation of tobacco use, cessation of use, and reduced exposure to environmental tobacco smoke. Motor vehicle safety. Crash-related deaths and injuries largely are preventable. From 2000 to 2009, the death rate related to motor vehicle travel declined largely due to safer vehicles, safer roadways, and safer road use. Safer workplaces. Through efforts by individual workers, unions, employers, government agencies, and others, considerable progress has been made in improving these conditions. Cardiovascular disease prevention. Since 1950, age-adjusted death rates from cardiovascular disease have declined 60%, representing one of the most important public health achievements of the 20th century.
Serving underserved populations and those in need of health and social services is a very important role of public health and our community partners. To tell us more about the Health Department's mobile health services is Myrna Chamorro.
Joining me now is Carlos Diaz from the Health Department's Mobile Health Services Program. Welcome, Carlos.
Thank you, Myrna.
Tell us a little bit about what the Mobile Health Services offers.
Well, we visit about 5 or 6 different locations in the county, including the county jail, to provide services. We have a proactive role, which we bring the services to the community, as well as reactive, supporting the hepatitis A outbreak.
Okay, so what are some of the services you offered? Screenings, referrals? Tell us about that.
Correct. We do A1C screening, which is for diabetes, cholesterol, blood pressure, information, referral, HIV testing, and vaccinations when available.
What partners do you have? So you mentioned some locations you go out to. Where do you go out to?
Right now, Shepherd's Hope, Grace and Grits, Rescue Outreach Mission, the County Jail, Remington Inn, and other non-for-profit organizations.
Not only that, do you do also special events?
Yes, in order to raise awareness for diabetes, HIV, STDs, things like that, we also partner with other agencies.
You mentioned referrals. What type of referrals do you offer?
Well, one of them is HealthLink. We help cover some of the costs for the specialists, eye care, dental care with the community services program.
So who can benefit from the mobile health services?
Just about anyone. We serve uninsured and everybody that needs those services.
So what other initiatives are available, including a home visitation program?
Correct. We have a health educator who goes to the houses of those people who have been released from the hospital. This is to avoid re-entry to the hospital system, and he completes an assessment of what the person might need, health-wise, securing food, transportation, things like that. He's supported by community health workers that also work for the health department.
Thank you so much, Carlos, for what you're doing with the mobile health services and for being on the program today.
It is my pleasure. Thank you, Myrna.
Joining us now is Ed Burford with the Veteran Services Program to talk about services in our community and a wonderful event they organized. Welcome, Ed.
Thank you, Donna. It's so nice to be here.
Ed, tell us more about the Veteran Services Program in Seminole County.
Well, we're provided for by Florida Statute 292.2, 10 and 292.11, which says that every county in the state of Florida can have someone like me. We are here to support the almost 35,000 honorably discharged veterans in the county. We help them file claims and file appeals through the bureaucracy we know of as the VA. We help the veteran, their dependents, and their survivors.
Excellent, Ed. How do people reach out to your Veterans Office? How do they learn more about those services?
People say we're the best kept secret in Seminole County.
Sure.
We file claims, we file appeals. Our veterans, these are for injuries or diseases that occurred while they were on active duty. No, they'd rather have their health. But last year, in the last fiscal year, the VA sent into Seminole County $248,563,000. Now that's in cash benefits as well as health care. This is not an entitlement program. This is a program where veterans earned this benefit.
Absolutely. Ed, who can, speaking of benefits, who can benefit from the program? Who qualifies for the program?
Well, first, any honorably discharged veteran. There's also benefits for surviving spouses if the veteran dies of a service-connected disability or perhaps a disability that would have been service-connected had he lived.
I see. And besides the office that you have that they can visit for the services, where else do you provide the service or information about the services?
We go where we're invited to go. We do a number of things in Seminole County. Of course, we're going to have a Veterans Appreciation Day come up in June where we have a Veteran Plus One, and we'll serve meals and we'll have a speaker. We also have an annual homeless veteran stand down. A stand down is when we were in Vietnam, the term stand down was used to bring people out of the woods, bring them out of the jungles, bring them to a central location where they could lick their wounds, read their mail, do all those things young men would do when they've just come out of combat. Today we refer to stand downs as bringing homeless veterans to a central location where we can reintegrate them with the VA and civilian service providers.
So at how many years has the stand down been held now, and where is it normally located? And then how many veterans have we been able to serve in those events?
Well, we've been working now on a stand down here in Seminole County for the past 9 years. We've probably served over 600 homeless veterans, and we've been so fortunate. We've had such a wonderful partner, and it's the Health Department of Seminole County. You guys have been great. What a better place to hold a stand down than right there.
It's been our honor, Ed.
And doubly, we don't turn people away because we're able to have the stand down in your facility. If someone comes through with an other than honorable discharge, or someone just stumbles onto it and needs the assistance, we're able to assist them. Maybe they can't get all the benefits that the veterans receive, but they get enough to help them get through this incident of homelessness.
It is a wonderful event, Ed. It's amazing how many services are offered at this event every year. Can you tell us about some of the community agencies that join us?
Well, of course, it goes without speaking that that you're there in the health department and your services are available, but we also have the full contingent of the Orlando VA Medical Center come up. Okay. Doctors, psychologists, suicide prevention, women veterans. We have the full contingent of that. We have other community partners come in. Homeless Services Network comes in. We have the Community Legal Services of Central Florida. We've got the Legal Aid Society. We have elements from the courthouse, from the Justice Center that come in. Nobody goes to jail that day. We have unfortunately been forced to Baker Act a couple people who were having some emotional issues, and that's unfortunate. But we have a full array of services, both partners and as well as the VA.
So Ed, what message would you like to share with the audience or leave with the audience regarding our veterans and the veteran services that we provide?
We're providing services that they have earned. This is not an entitlement program. These are men and women who are injured, who suffered disease that occurred while they were on active duty. It's no fault of them. They've got issues. We're here to try to support them, try to give them the help that they want, the help that they need to just get through the next day.
Thank you so much, Ed, for joining us today and for sharing information about veteran services. And I know we'll have the phone number up so that folks can call.
Good.
Thank you so much.
Thank you for having me.
The role of public health is to protect, promote, and improve the health and safety of all Floridians. Public health is all around you. It addresses broad issues that can affect the health and well-being of individuals, families, communities, populations, and societies, both now and for generations to come. Thank you to our distinguished guest, and thank you for joining us today. I'm Donna Walsh for Healthy Seminole. See you next time.